Let's kick off the show from the health sector. For this time, the Lagos State government is soliciting more collaborations from healthcare providers in order to improve service delivery to the enrollees. Now, the Permanent Secretary, Ministry of Health, Dr. Olusegun Ogboye, who was at the first Ilera-Eko Providers Forum, says collaboration have become necessary to achieve healthcare insurance in Lagos. Take a look.
Senior health officials and healthcare providers registered under the Lagos State Health Insurance Scheme called Ilera-Eko, as well as other stakeholders in the health sector, gathered to deliberate on how to improve their services. The General Manager of the State Health Management Agency, Dr. Emanuela Zamba, sets the tone for the discussion, highlighting what has been achieved through the partnership and plans for better services.
With the passage of the Lagos State Health Law in 2015, Lagos State's role toward health insurance began more than 6 years ago, with full commencement in 2020. And the current administration of His Excellency Governor Babajide Olusola Sanwo-Olu is committed to ensuring that all residents of Lagos State, regardless of their socio-cultural background or economic status, have access to quality, equitable, and affordable health care as a step towards universal health coverage in our beloved state. The agency has partnered with several organizations, including a diverse mix of health providers, to ensure that all residents of Lagos have access to quality and affordable health care. These partnerships include public and private healthcare providers, primary healthcare providers, secondary and tertiary healthcare providers, general practitioners, specialists, be they laboratory, diagnostic service providers, nursing care, and pharmacists, including hospital community pharmacists. Even though the providers of healthcare services are the frontline partners and very critical partners to the scheme in delivering the value of healthcare to our enrollees, other partners at the back end have also participated in strengthening the agency across all the building blocks of the health system, and for this we are grateful.
Achieving and sustaining health insurance scheme is a priority for the government, and the chairman of the State Health Service Commission appeals to partners to ensure quality service.
For us to really have a brighter future, then we have to get it right. From inception to the nurturing and then to the growth of what LASHMA or the desired LASHMA that you and I want, not only for this state, but that other states can actually replicate as well. I am confident that if we get it right with LASHMA as Lagos State, then all other states will get it right. Majority of the health facilities that are supposed to enjoy and even partake in this desirable project is actually the primary health care. I had been the permanent secretary of primary health care, and there was a thematic spread to be able to identify all primary health care centers that are here and for the population that it feeds. And I think that is where your largest catchment should be. And in our debate today, I want primary health care to look into this and take it seriously.
Wearing the cap for the State Commissioner for Health is the Permanent Secretary, Ministry of Health, Dr. Olusegun Ogboye, and he reads his speech.
Ilera-Eko provides various healthcare services across different spectrums of care, and Lagosians have benefited immensely from this scheme in the areas of access to quality maternal and child health services, immunization, outpatient and inpatient treatment of medical cases, quality laboratory and diagnostic services, and surgical procedures. We have taken actionable steps towards improving access and benefits on Ilera-Eko by expanding the health benefit package on the Ilera-Eko plan, and various provider improvement initiatives are also being implemented, from technical training to the distribution of drugs to address the out-of-stock syndrome. We have also deployed the Ilera-Eko customer app, the Ilera-Eko telemedicine app, the Ilera-Eko USSD and QR codes. You will agree with me that the scheme is indeed a customer-centric one. However, in spite of all that we have achieved, there is still a lot more to be done. Firstly, we must strengthen collaborations and partnerships with all stakeholders key to the healthcare delivery system in Lagos. And I personally believe that having a platform such as this forum is a critical step to achieving this.
Other stakeholders call for more attention on public health issues such as gender-based violence and welcome more collaboration to expand the Ilera-Eko scheme.
Responding to sexual and gender-based violence has been designated as a public health concern. During COVID, it was referred to as a shadow pandemic. With the increase in formal and informal reporting of domestic and sexual violence cases, it is therefore most compelling for our symbiotic relationship with LASHMA. Through the Sexual Violence Intervention Fund, we are able to provide access to free medical attention to survivors of sexual violence. We are indeed grateful for this partnership. We look forward to a mutually beneficial partnership with LASHMA, even as we remain committed in ensuring we reduce these menace to the barest minimum.
LASHMA says over 756,000 residents are currently registered under Ilera-Eko and welcome more people on board.
What we have is all inclusive. We have public facilities, be they primary, secondary, or even tertiary. And we also have private providers, be they primary or secondary providers. All of them together provide healthcare for us in Lagos State. We even have the specialist facilities, such as diagnostic services. We are partnering with them on some of our programs. We even have dental services as well. We've now recently started working with the nurses, so they have nursing homes and things like that. We are bringing them on board to come and provide care as well. And we are also in conversation with the community pharmacists, for instance, to see how we can partner to provide access. Lagos is small landmass, but we have a lot of people and there's a lot of ground to cover. And so we are constantly looking for ways to ensure that wherever you live in Lagos, you have access to care. So I think one of the key things is to formally, all of us identify what resources we have in Lagos State and use those resources to leverage on them to be able to provide or fulfill the mandate of LASHMA. One of those resources is that we have the largest private sector anywhere in Nigeria. So that's why we are partnering with the private sector. We are also blessed to have a retinue of partners, donor partners, and implementing partners that are working with us, constantly looking at strategies and ways to support us. We've also, when you say something is mandatory, you have to consider that somebody has to pay for the vulnerable, which is largely the responsibility of government. That is something that Lagos State is fulfilling, because if you are not supporting those people, you are not doing universal health care. So we have an arm of the agency that we have set up called the Eco-Social Health Alliance, which is to help us pool resources together so that as those that can afford it are paying for themselves, we are able to pay for those that cannot pay for themselves, and everybody now has access to care. We are looking at ways to improve the quality of services in our facilities, either in terms of their infrastructure, in terms of equipment, in terms of consumables or drugs. We don't want to hear things like out of stock. And so on and so forth. And those are the things that we are looking at here. And the agency is fully ready to continue to engage the providers, ensure that we have an open door policy where we get feedback, and we use that feedback to improve on what we are doing as we go along.
The climax of the event is the presentation of awards to medical directors and health workers who've conducted themselves in an exemplary manner.